So next to present is Jovanni David Luna. He joined the program this year in 2011, and he will be speaking about Schindler disease. Schindler, thank you, disease.
Okay. I researched Schindler disease at Bronx Community College, and my mentor was Dr. Bernal and Miss. Okay, to begin with, there's three different types, and this is the first type, and it's a lysosomal storage disease, but like more narrowly, it's a glycoprotein storage disease. And type 1 occurs around like the age of 1, and children typically do not survive out of the childhood. And some of the symptoms of type 1 would be that they lose skills that they learned throughout their first year of life, and they cannot like learn more. And there's a loss of physical and mental behaviors. In type 1, they can develop blindness, seizures, become unresponsive, have diminished muscle tone, weakness, discoloration of the skin, they lose awareness of their surroundings, and they have involuntary rapid eye movements and other symptoms. Next is type 2, which is, I can't really pronounce the name of that, Kazi disease, I think it is. And it usually starts within like the late teenage life to early adulthood. And when the person develops this, they have like cognitive impairment. And if you don't know what that is, it's like intelligence, mental function, like problems, which is like mental retardation. They have hearing loss, and they had with their skin, they tend to have small dark red spots, and it's like clusters of enlarged blood vessels. And they also develop problems with muscles and sensory cells and nerves that affect the brain and spinal cord. And this leads to like more weakness within like the muscle tones, and they become like unresponsive to touch and the environment. Okay, the next one is type 3, and the symptoms are like intermediate between type 1 and 2. And it has some symptoms that occurred from the infancy one. And this includes developmental delay, seizures, a weakened and enlarged heart, and an enlarged liver. And this can also lead to autism spectrum disorders and more impaired communication and socialization skills. Okay. Now, the genes that are affected by it, since it is a genetical disorder, is a mutation that occurs in the, is known as NAGA, which stands for this. Can't say it. And it has a specific gene sequence, and when it's blasted on the International Genetic website, it's located on the long arm of chromosome 22 between these base pairs. And within the NAGA gene, there's 7 known mutations that causes Schindler's disease. And the NAGA gene is responsible for the enzyme, which is there. And its basic function is to help lysosomes break down glycoproteins and glycolipids. And what scientists infer is that these mutations causes a change in the 3D shape of the enzyme, and because of this, it can no longer break down the certain glycoproteins and glycolipids that it was supposed to. And as a result, the lysosomes will like cause like malfunction and cause the cell to die. And this, since cells are dying, it causes damage to organs and tissues. And this is a picture, and it shows like, over there it shows like the 3D structure of the enzyme. And, yeah. So. And here's the inheritance, and it's an autosomal recessive disease. And for the child, that means that for a child to, or anyone to have the disease, they would need both recessive genes. And here's the probability. If both parents were carriers, there's a 25% chance that the child will show like the symptoms of the disease. And if one is a carrier and the other one actually has the disease, it's a 50% chance. And if for some reason both parents have the disease, then there's a 100% chance that the child would have it. And there's certain ways to test for Schindler's disease, and one of them is a urine test. And you would find like large sugar molecules, since the lysosomes like do not function and cannot break it down. There's also a blood test or a skin biopsy, and scientists will use, or doctors would find like a lack of the enzyme which the NAGA gene affects. And you can also look at the family history and the visible signs of the disease. And here's my references. And I would like to acknowledge Dr. Sack and Dr. Bernard and Ms. McGann. It doesn't like, it's not biased to a certain gender, but it can happen to anyone who, like, well, it depends on the child that was born, like the gender wise, but it can affect both genders. But this disease is rather rare, and it has only a few individuals for each type. So.
Is this all data from the United States?
Well, if you look at the international, I forgot what the website was, but there's an international website that contains like all the genes and diseases, and it's like studies around the world. I don't remember the name right now, but I'll give it to you later. Yeah.
Next presenting